in addition to this, there is other kind of deficient type pain, deficiency pain. So, for example, Qi blood deficiency is essence deficiency, leading to the some organs, leading to the meridians, muscles fail to be nourished, moistened, also can give rise to the pain. That is deficient pain. So for the pain, we should ask, for example, location of the pain. Where is the pain located? That is first we should ask. Second is the nature. What is the nature property of the pain? Can give rise to the pain. That is deficient pain. Location of the pain. Location, which area, so regarding which some organs or regarding which meridian, so it's important to the diagnosis of the pain. So second is the nature. For example, headache. What is the nature property of the pain? Headache, for example. So I'd like to ask you for the headache. How should we ask the patient? Location. About the location. How do we ask if the patient has a headache? So what should we ask?
Location, how long, and what sensation?
What
the sensation, like needle or?
So the location of the headache, how to differentiate?
Forehead is Yang Ming. Yang Ming, and then the back of the back is Shao Yin, and then the
Shao Yin
or
where is Shao Yin?
Wait minutes. In the side is the Shao Yang. Yes. And then the back is Tai Yin or Shao Yin. Tai Yin, I think. Forgot it.
Confused, huh?
Forgot it.
Other opinion? Any other opinion? Anybody else?
In the back is Tai Yang, Lao Sir. Tai Yang.
Tai Yang, yes, right. Not Tai Yin.
Yeah, not Tai Yin, Tai Yang, sorry. Yeah.
Yeah. And what else? Forehead, Yang Ming, two sides, lateral, Shao Yang.
Shao Yang.
And the back
is Tai Yang.
Okay.
And then the top is wait a minute.
Vertex here. Vertex, this area. To be can
the
be
top
the
is Yin.
Yin. Yes. Yin. Okay. So that is the which area? So that means correspond to the meridian, which channel regarding the headache. For example, so forehead here area, and also this area, and also the eyebrow, and this to the eyebrow here, this area, Yang meridian. Stomach and the large intestine. So Yang meridian. So in the treatment, so we may select the point or meridian of stomach and the large intestine. So Yang meridian, and back of head, neck connected to the neck, nape, back side of neck. So cervical area, cervical, even to the back, upper back, connect to the upper back. So can be usually regarding Taiyang meridian, bladder, and small intestine, and both sides, temporal, temperament, temporal area region. So like Taiyang points, extra point Taiyang, or this both side, lateral side. So usually we say Shaoyang headache. So we better choose the point of Shaoyang gallbladder and Sanjiao, so meridian and the point. Okay. So when there's a headache here on vertex, so liver meridian. So we may choose some point of meridian, Jiayin liver and pericardium also. So that is the pain regarding the meridian. Okay. And also the pain, headache, sometimes not only the region, but also the property of the headache. So there is a new disease, headache. For example, common cold, influenza, headache can cause headache. No matter wind, cold, wind, heat, dampness, and fire, and summer heat, and so on. And also the endogenous disease also can give rise to headache. For example, phlegm, dampness, phlegm, turbid phlegm, and blood stagnation, and so on. So all these, just now I mentioned the exogenous, external syndrome, or endogenous turbid phlegm and blood stagnation. So that is excess type headache. So in addition to this, but also there are some other kind of deficient type. So that means deficient type due to the Qi blood fail to ascend, fail to nourish upward, so feel empty pain. So like empty pain and dizziness also can cause pain. So we have to differentiate which kind of type, deficiency or excess. Okay. So that is headache. Headache is a common symptom. Second is chest pain. Chest pain usually regarding, of course, the lung and heart, right? Lung and heart. So probably the patient will tell you something about the history of the heart disease and lung disease, heart disease, for example, coronary heart disease. So patient has a chest pain. So this is sometimes it's a kind of colic pain, stepping pain, puncturing pain, or stepping pain, or colic pain. So to the lung, lung disease, of course, when there is, for example, pneumonia and acute bronchitis, asthma, and pulmonary carbuncle sore, sore of pulmonary suppurative infection, for example. So also feel pain. And the tuberculosis sometimes, TB, pulmonary tuberculosis also. Sometimes retention of fluid in the thoracic cavity also give rise to pain. So can be different kind of disease and syndrome. Okay, chest pain. So we have to differentiate what kind of pain. Okay. And the hypochondriac pain. Hypochondriac pain. So how do you like this kind of pain regarding which sound organ?
Liver and gallbladder, Doctor. Liver and gallbladder.
Liver and gallbladder. Yes. Yeah, because the liver gallbladder distribute here, and the meridian of liver and gallbladder also go around this area. So when there is a disease, liver disease, gallbladder disease, so even meridian of the liver gallbladder also give rise to the different kind of pain in this area. So okay. For example, hepatitis and cholelithiasis, and no matter acute and chronic, so patient feel upset this area. Okay. So of course, the pain can be different. Sometimes distending pain, sometimes stepping pain, sometimes colic pain. So regarding the different disease, for example, for the parasite, in gallbladder, so that is kind of a colic pain, or stone of the gallbladder stone, also colic pain, or stepping pain, colic pain. For the inflammation, cholelithiasis, inflammation, gallbladder inflammation is kind of distending pain. Also, the hepatitis also is kind of a distending pain. For the, for example, some even some other disease like cancer, also cirrhosis or cancer. So especially the late stage of cancer, liver or gallbladder. So that kind of pain is stepping pain, like needle puncturing, stepping pain. Number 4, epigastric pain. So that usually regard the stomach to the organs. Stomach correspond to this area. So different kind of many diseases of stomach give rise to epigastric pain. So the causes can be different. Can be different causes. For example, attacked by invasion of cold, heat, or retention of food, and stagnation of qi, stagnation, blood stasis, or or disharmony between the stomach and liver, or spleen, liver, give rise to the, descending, ascending disorder. So will result in the pain, different kind of pain. The pain, of course, we have to differentiate that the pain is excess or deficient. That's important. In addition to the nature, the cause of the pain, causes of the pain, but also the excess or deficient. So how do we know the pain is excess or deficient?
Maybe
Lanjut bro.
maybe we have to ask the patient whether he or she feels the pain after he or she takes food or not. Also, if the pain happens after the patient takes food, then it is deficient. But if the pain happens before the patient takes food, it is excess.
Yes, right. Yeah. And anything else? Any factor regarding the excess and deficient else?
About the pressure, when we push the pain area, if the pain is really the pain is more painful, it means the excess, and then when we push the pain area is less than the pain, less pain is deficient.
Yeah, very good. Very good. Yes. Yeah. So yeah, right. That's right. So we better ask just now two of you give a correct answer. So firstly, we should ask regarding the eating. So if a patient after eating feel better, so when patient eats something and later feel better, so that is a deficient. If after eating more pain, so that usually that is excess. And also we may check with our palm, with our finger and palm to press the pain area. When patient feel alleviated, the pain is relieved, that is deficient. When patient say feel more pain, refuse to be pressed, put your hand out, put your hand away. So that means more pain. When you press, more pain. For example, when pain is due to retention of food, for example, the patient come to you morning, say, last night, last evening, last dinner, yesterday dinner had a big dinner and drink a lot of alcohol and eat a lot of meat, fish, and with friend or with family. So very big dinner, too much eating, and then today so come to you feel very painful, even even regurgitation, sour, faded, the kind of bad smell, regurgitation, belching, regurgitation, even the air come from the anus, and also could be diarrhea, also can be. So, and when a patient even eat something, even feel more pain. And in this case, if you press the area of the pain area, so patient feel more pain. So they cannot tolerate the pressure. So that is definite, excess type. So, and in addition, other kind of, for example, some kind of ulcer, and gastritis, kind of inflammation of the stomach and the duodenal, or even ulcer. So patient, they after eating they feel good,